Hey guys, today I'm going to talk about ankle pain, especially the acupuncture treatment and Chinese medicine diagnosis for ankle pain, and also the Western medical overview and analysis. So, first of all, I will talk about what is ankle pain. Um, the ankle sprain, actually ankle sprain. Yeah. So, what is ankle sprain? An ankle sprain is an injury that to the ligament of the ankle joint caused by excessive stretching or tearing. It most commonly occur when foot suddenly twisted inward or outward beyond its normal range of motion. Um, and the majority of the cases involve the lateral ligament complex, accounting for approximately 80 to 90% of all the ankle sprains. So, what is the mechanism of the injury? Actually, the most common mechanism is inversion injury, like for example, the foot rolls inward. It often occur during sports, walking on an uneven surface or missing step. So those type of um, um, injury actually it's what we call the typical order of ligament involvement. The first one, anterior. So usually we just say ATFL, anterior talofibular ligament. So that's one of the ligament that's most common to be injured. Um, so so that is ATFL. Mm, and then the second one is called calcaneal fibular ligament, CFL. CFL. Um, so maybe we can do some search. Maybe this one. Yes, as you can see on the screen, the lateral ankle ligament. So this is the anterior talofibular ligament, ATFL. It's here, and then the second one, CFL. That's also common injured. So these two ligament, and then actually, as you can see, there's also another one just at the back of the top of the heel, PTFL, posterior talofibular ligament. So these three ligament, they all attach to the fibular bone. Yeah, that's why it's always called talofibula. So Talus bone. Yeah, so I can show you on another photo. As you can see here, talus bone. So this is talus bone. That's called calcaneus. Usually we call it heel bone. So the talus bone actually there's tendon is connecting to this fibula and this talus bone. You can see. So there are three tendons, and two of the tendons is connecting between. As you can see, one is anterior talofibular ligament, and one is posterior. So they both connect to the same two same bones, and then the one in the middle, calcanean fibula ligament. So this ligament is connecting the fibula and the calcanean bone, which is the heel bone. So that's the three ligament. So that is the most common injured ligament involved. So how about the severity of grading? For example, if it's mild, usually the ligament gets stretching and without tear. So there will be mild pain and swelling, minimal functional loss, and the recovery will be like around 1 to 2 weeks. And there will be also grade two. So usually there will be a partial tear on the ligament, so in that case, the recovery will be slightly longer, around 3 to 6 weeks. And then the severe case, there will be complete ligament rupture, and you can see significant swelling and instability, and couldn't really bear any weight. And usually, the recovery will be 8 more weeks. So now let's talk about the clinical presentation. So the common signs and symptoms including pain, of course, and then swelling, and then bruising, and reduce the range of motion, and not lost the balance, or like instability in more severe cases. A key clinical clue will be a reported popping sound at the time of the injury, and followed by rapid swelling may indicate a more severe ligament injury. So now let's talk about the physical examination. The first one will be localized tenderness. So you'll be definitely feel some tender, especially if it's over 80 FL. Yeah. So most of the ankle sprain, they have lots of pain around the ATFL ligament. And then of course, there will be two tests. One is called anterior drawer test. Another one is called tilt test. So we can have a look at these tests.
On it just by thinking about it. Meet base 44.
So we bend the knee up to 90 degrees. Again, we have to get the patient's permission. I'm going to sit in your foot. So we don't want to just jump on their foot because it gives them a fright. So sit on your foot. And what I'm going to do is pull first anteriorly and then posteriorly. So anteriorly, solid endpoint, no laxity there. Posterior draw, looking at the PCL, very solid, no laxity, no pain.
So this one is called anterior drawer test. That's a very easy test. And then we can have a look at another one.
In this video, I'm going to show you how to do the talar tilt test to assess the integrity of the anterior and posterior talofibular ligament, the calcaneofibular ligament, as well as the deltoid ligaments. Hi and welcome back to Physio Tutors. According to Hertel et al. In the year 99, the talar tilt test has a sensitivity of 50% and a specificity of 88% in the diagnosis of lateral ankle sprains. To do the test, have your patient sitting with his knee hanging off of the table. In order to test the anterior talofibular ligament, bring your patient's foot into plantar flexion so that the ATFL is perpendicular to the movement that you are going to perform. Then, grab the calcaneus and perform inversion. In order to test the calcaneofibular ligament, bring your patient's foot into the anatomical position so that the ligament is perpendicular to the long axis of the talus. Then, bring the foot into inversion and eversion. The eversion part of this test stresses the deltoid ligament complex on the medial side. And lastly, to put the most stress on the posterior talofibular ligament, bring the foot into maximal dorsiflexion and perform the same movement again. This test in different positions is considered positive if your patient complains about pain or if you find excessive gapping compared with the unaffected side.
And then when so now I'm going to talk about the imaging and when is the X-ray needed. So we can use the Ottawa ankle rules to determine if the imaging is required. The X-ray is recommended if the bone tenderness at the malleoli so I can show you. Can show you a photo of it. So I couldn't find a photo. So usually it's so the malleoli is just means that the prominent around rounded bony bumps on either side of the ankle joint. So if you see any malleoli at the bone tenderness and inability to bear weight for the 4 steps, and that's usually suggested to do the X-ray because we might be worried about if there's any fractures. And then, so how do we manage the pain? So if it's acute stage, usually it's the first 48 to 72 hours. So there is actually a traditional approach. It's called RICE, rest, ice, compassion, and elevation. And and then a more modern approach, you can also you can call it peace and love, because it's emphasize protection, education, and early function of recovery. So what about the medication? So actually the NSAIDs, such as the ibuprofen, may be used for the pain relief and inflammation control. So that is about the in the West medicine perspective, the ankle sprains. And so in the practical clinical insight, the injury itself is really the problem, but the poor rehabilitation is, because a lot of the patients, they could manage the acute pain well, stop the treatment once the symptoms improve. So it will make the treatment result doesn't last long. So on the Chinese medicine perspective, ankle sprain occur when external force causes excessive stretching or tearing of ligament, tendon, and other soft tissues around the ankle joint. It's often commonly accompanied by swelling, pain, and restricted movement. That's all this. As I'm still talking about the Western medicine way. And then, what I'm gonna talk about the actually is more on the acupuncture treatment for the ankle sprain focuses on the core treatment principle. For example, including promoting meridian circulation, dispersing blood stasis, regulating tendons and connective tissues. So by addressing the root of the injury, acupuncture helps to reduce the swelling and pain, to promote the tissue repair, and lower the risk of the chronic instability. So it is particularly suitable after the acute inflammatory phase and during the recover or chronic stage. So what's the common points used for acupuncture treatment? The point including, so the first one I'll talk about the ash point, which is the trigger point, and also which is the tender point directly on the spot of the pain. It's usually help for the immediate pain relief. And then there are also a few points which will help with the blood circulation and reduce swelling, including stomach 41, GB 40, bladder 60, and kidney 3. But of course, different pattern, we also add on a different group of points. For example, if it's on the acute stage, we especially if there's a redness and heat, we could add large intestine 11, large intestine 4 to clear the heat and reduce inflammation. And then we can, if it's a recover stage with dull pain and weakness, we can add the stomach 36 and spleen 6 to nourish the qi and blood flow. And if it's a chronic spring, we can use gallbladder 34 and gallbladder 39 to strengthen the tendon and bones. Sometimes we can also add some backstroke points to regulate the organ. For example, bladder 11, which is good for liver, bladder 19, good for gallbladder, bladder 20, good for spleen, bladder 23, good for kidney. So it will help maintain the tendon muscle and the joint stability and improving the long-term progress. So that is the Chinese medicine treatment, acupuncture treatment. So another, it's just a little bit of a precaution as well. So usually within the 48 hours, I think I will go back to this one. So within the 48 hours of the injury, so acupuncture we only start, we will use some cold press and then we can start the treatment. But the things we have to avoid, including weight bearing and avoiding running, jumping, or prolonged walking, and try to wear supportive or anti-slip shoes, and even consider about ankle braces to prevent the re-injury. So if fracture or dislocation or open wounds or infection or clotting disorder are present, these must be addressed first before considering acupuncture. So in general, swelling and pain may significantly improve within 3 or 4 or 5 sessions. Chronic cases may take a longer treatment, and with also some rehabilitation exercise for long-term stability. So in conclusion, so acupuncture is a gentle and minimal invasive treatment option for ankle sprain. It can relieve the discomfort and shorten the recovery time, especially suitable for the patients who prefer to avoid the medication. and and also they don't want to tolerate the anti-inflammatory product, or they experience recurrent or chronic ankle injury. So when combined with a proper rehabilitation and the protective care, acupuncture will help restore the ankle flexibility and reduce the risk of future sprains. So that is about the acupuncture treatment for ankle sprain. Thank you for your watching.